Welcome back to the Black Health Lit podcast. This is a space where we can be Black, proud, and healthy. On today's episode, pharmacist Ashley Griffith tackles crucial questions from tailoring health solutions with vitamins to debunking all natural myths. Learn to navigate product safety, understand side effects, and empower yourself in healthcare decisions. Discover the ripple effect of non-adherence and effective strategies for better health outcomes. Tune in for a healthier, informed you. As a reminder, the content provided on the Black Health Lit educational podcast, website, and blog are for informational purposes only. The information shared is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Make sure you like, subscribe, and share this episode. Also, while you're here, check out the episode description to learn more about today's guest and shop the Black Proud Healthy merch. When you shop merch, you're helping to support future episodes and free health education for the Black Health Lit community. All right, welcome back to the Black Health Lit podcast. Today I'm talking with Dr. Ashley Griffith. We are going to be talking about vitamins and supplements and all natural approaches to health and wellness. Before we get into the topic, Ashley, can you introduce yourself to my audience?
Yes, I'm so grateful to be here. Good afternoon. Happy New Year. I am Dr. Ashley Griffith, clinical pharmacist. I specialize in emergency medicine and also integrative health medicine. And what does that mean, essentially? So I am your classic pharmacist. I push drugs, I deal drugs, all of those fancy things. And I help people figure out how to incorporate vitamins and supplements in a healthy manner. One of my major mantras that I hope that we gather from this interview is that vitamins and supplements are just as dangerous as prescription medication, just as many interactions and side effects. And if we know how to use them appropriately, we can get all the benefits from them. So it's not that the same way you wouldn't just go pick up a blood pressure pill off the shelf and just take it. I want you to have that same approach when it comes to vitamins and supplements. So that's what I'm hoping to be able to communicate.
I love it. That's great to know that, because we don't think about vitamins and supplements in that way. And we'll get deeper into that topic a little bit later into the episode. But just to kick us off, that's a great segue into everybody's into vitamins, everybody's into supplements. Are there specific populations or conditions that necessitate the use of vitamins and supplements, or is it everybody should be using them?
So that's a great question. And I do believe that everyone should be taking vitamins and supplements. We just all don't need the same type, correct? So I say that as a pregnant woman does not need the same supplements as a 60-year-old gentleman that may be having prostate issues. We both need vitamins and supplements. We need them in different amounts based on where we are in our lives. You know, if we're menstruating women, heavy cycles, we may need to be looking into more iron supplementation because we may run the risk of being anemic, as opposed to my mom who's in menopause and she needs to focus more on bone health and calcium and vitamin D, right? So we all need vitamins and supplements. We just need different ones. And that is so important. I always laugh when I see, a mom that has a lot of kids coming into the pharmacy and she's giving everybody the same multivitamin. And I get it.
God. It's easy.
I was like, but he's 13, your daughter's 9, you're 42. I don't think everyone needs the same multivitamin. I see what you're doing, Mom, and I get it. But let's tweak it a little bit.
Yes, for sure. And to add to your first comment about going out and picking vitamins up off the shelves and how dangerous that can be, it's so important that people always check with their doctor and or pharmacist so that they can make sure that there's not interactions with some of the medications they're taking. Or I'll use myself for an example. As part of my breast cancer journey, to prevent recurrence, I was prescribed a medication and it has some side effects. So one of my girlfriends was like, you should try sage. It was either sage or black cohosh. I can't remember.
Okay.
Talked to my oncologist. He was like, not for the treatment that you're doing. And if I hadn't have checked with him, I would have just done it. And I believe it was black cohosh, and it can mimic estrogen. You probably can speak to
Exactly.
that more better than I can. But he was like,
Yeah.
your breast cancer was hormone receptor positive. We don't even want to pretend. He
We're
was
adding
like,
additional
no,
hormones. That's
absolutely.
such
So
a
I'm so glad I checked with him. Because that could have been life change. That could have been very dangerous for me to just go pick some up off Amazon or CVS or wherever. So
great.
that's a real world
Exactly.
example of how dangerous it can be to just pick up vitamins.
Yeah, and we learn so much, with our friends. We when we're dining with them, we're going to eat what they're eating, drink what they're drinking, and that kind of the culture that happens with the vitamins and supplement industry, and it
Yes.
just makes people open for a high risk, just
Yeah.
high risk situation. Absolutely.
Yeah. What would you say are some of the misconceptions around the term all natural when
Yeah,
it comes to health and wellness products? Because that's something else. Like you said, we sit around a dinner table and we talk about, I'm all natural, girl. I'm all
yep,
natural. Or hey, I'm going to the gym. I'm all natural. It's like,
all natural. That's
I don't
such a
know
great
about that.
Yeah, that's such a great point, and it's really rooted in our obsession with the word toxin, right? Our
Yeah.
obsession with the word all natural. It's just the opposite of toxin. We don't want toxic hair products. We don't want toxic cleaning products. We don't want so it rolls over into our foods, our vitamins, our medications, just over our lifestyle. We know the scary word of toxins, right?
Yeah.
And what when it comes to medications, I always try to communicate with my patients and my students is that the danger is in the dose, right?
Mm,
In the dose. That is what changes it from a medication to a poison. It's
gotcha.
not it's not always just necessarily how it's created. Is it a plant or is it synthetic? It's really the danger in the dose. Heroin is a plant, right? Heroin
Yeah.
is a plant. We also know that what that can do, it's an all natural. It comes from the ground, but we also know the dangers that that can cause to the
Yeah.
system. So that the all natural is rooted really, it's crossed over into all aspects of our lives. When I look for hair products, I want that all natural shea butter. I don't want synthetic. So, it rolls over because of our obsession with the word toxin, and we just
Yeah.
don't understand. When we see the word natural, it makes us feel that it won't do us any harm. It's
Yeah.
safe. We don't run the risk of any dangers, and that is a marketing scheme. We
Yeah.
do understand just how the food industry, the drug industry, I try to tell people this vitamin and supplement industry is worth $79 billion,
Wow.
and that is that is something that we really want to hone into, that marketing verbiage, tricking us into really believing that those words, all natural, all safe, plant-based, it makes you think that you're somehow getting a more holistic product.
Right.
And if we educate ourselves, we can start fine tuning and reading in between the lines and completely understanding what we're consuming.
Right. Right. And you bring up a really good point about heroin being from the earth. A lot of things from the earth are dangerous,
Yeah,
and I'm a plant person, so I have lots of plants. I'm looking at
yeah,
some of them right now in my home, and some of them are dangerous. They're like I have one, it's beautiful. It's probably about 14 inches tall. I'm looking at it. It has like
oh,
pink edges and like
beautiful.
kind of like white freckles on the green
Oh,
leaf. But in the summertime, it leaks like this sap onto the leaves and it will literally burn your finger.
yep,
It will literally burn your finger. And so imagine if a pet ate that. Well, if I ate it, if a
yeah.
pet ate that or a small child, and it's natural and it is a beautiful plant, but this plant will jack you up.
Exactly, exactly. I would love to see that plan. That's beautiful. Yeah,
Yes, yes. I'll show you I'll send you a picture of it. But
yeah.
I have several of them, and when I first started buying plants, I was like, okay. And
Okay.
another example, the dumb cane plant, which
Yeah.
was used during slavery um, to make the slaves' throats and mouths swell up,
Yep.
and they called it the dumb cane because it made them sound they call it dumb, but it's a dangerous plant. Also very beautiful and
Yeah,
all natural.
all natural. And it was the way that you were able to grow and disguise it amongst everything else that you're
Yes,
growing. You know,
yes,
herb, like I tell you, it's just as potent and just as dangerous. We need to know how to use them
correctly. Right, right. Yep.
correctly.
Yep. So how can consumers differentiate between genuinely safe natural products and those that might pose a risk?
Yeah, that I get that question a lot. And one of the things that I want people to understand is that the FDA does not regulate vitamins and supplements.
Not at
That's
all.
the first thing that we want everyone to understand is that it is not regulated. So you pretty much have a wild, wild west really going on right now within the vitamin and supplement industry, which is why why they use such keywords and trickery to get you to purchase the supplements, right?
Yeah.
And I say this to say that one of the most important things is making sure that your vitamins and supplements are third party tested. And why I say third
Oh,
party tested is because you don't want to, if you're purchasing a Nature's Made supplement, your test should not be completed by Nature's Made. Okay,
agree.
right? When that's one of the major things that we always look out for bias. If Pfizer is putting out a drug, I need to for me to promote that drug, I need to see another company do the study, because
Yeah.
you understand that with statistics, numbers can be fudged, of course, to be put in your favor, right? So two
Right.
companies that are really great independent companies is the USP and NSF, and we can add the link so we can all see that so you can share it.
Okay.
And
Okay.
it's a USP seal and an NSF seal that shows good manufacturing practices. So it's determining that if your tablet tells you that it has 5,000 international units of vitamin D, that it
Right.
actually has it. It's hard to believe that you're out here purchasing supplements and it can say 5,000 international units, and then when it's tested, it's two. And
Oh
you
my.
already spent
Yeah.
$5 more to make sure that you got five,
Yeah.
so accurate. What I love about these independent testings is that it justifies the potency, the efficacy, and the sterility of your product, making sure that there are no other additional contaminants.
Okay.
And the NSF goes a little bit step further. They're your type A of third party testing. But why I like the NSF, and I'm going to add that seal, why I make sure I find that on my supplements, is that they do inspections of the facility. And that is the
Ooh.
added, yes, yes. So the USP, you see that seal on Nature's Made, Centrum, your traditional
Yes.
vitamin that you see at Walgreens and CVS. And it's a great seal. You know that your product is accurate. But what I like about the
Right.
NSF is that it goes into the facility, right? Is your supplement being processed with a meat market at the same time? Because they can
Ooh.
do that as
Oh
well,
my God.
How many times do we find E. coli on spinach? So a lot of times these
Like twice a year.
manufacturing plants, yeah, right. It's like, yeah, I gotta throw away that smoothie. Every time I buy a bag of spinach
Yeah.
from Costco, I gotta throw it away.
Yep. Again. Yep. Yep. That's good to know. I have seen USP a lot. I don't know. I'm gonna look at my vitamins when I go downstairs because I do take vitamins. I've taken them my whole life. I notice the difference when I don't take my vitamins.
Yes.
I don't think it's a placebo effect. I've seen a difference in like my lab work, for example. A lot of black women particularly have low vitamin D, especially in the Midwest where it's gloomy like it is today and there's no
Wow.
sun
Yeah.
has not been out. It won't come out for a week sometimes. And so my
Wow.
vitamin D was low, of course. But since I started the supplement, it came up. It's in
Yeah,
range and all of that. So, you know,
it
something to
does
be
work.
said for thinking that.
Yeah. And
I
with the NSF, just wanted to mention they also have one for sports. So a lot of athletes and athletic supplements, they have an NSF sports that the Academy of like sports medicine, they require supplements for athletes to not contain certain contaminants so that when they get tested for professional sporting,
yeah.
cross-contamination. So it's the third-party testing is very aware in the sport industry because they know the risk of like the contaminants, how it can affect testing, when they're getting ready to perform. So
Hmm.
you're going to see more NSF, more in like sports testing, and USP more commercially. But I do recommend both, and we should just have that general knowledge base behind
Yeah.
our third party testing. Yeah.
Yeah. That's really good to know. I will definitely look at that going forward. I already shared a little bit of my journey and my personal testimony on checking with a health my oncologist, my healthcare provider with vitamins. But can you add to why it's so important for people to discuss potential side effects or which supplements they're considering with their healthcare provider?
Oh yeah, absolutely. I will just speak about there are many to speak on, but one of importance I'll say we'll use with the demographic birth control, right?
Okay.
So many women are on birth control due to heavy menstrual cycles, family planning, fibroid development. We all have, we see the dispensing of birth control to women
Yeah.
across the country. With the start of certain vitamins and supplements, for instance, St. John's wort, it can cause the efficacy of your birth control to reduce, running your risk of pregnancy, right? So you have vitamins and supplements that can definitely make that type of medication not as effective. Another type of medication, let's think about some people are on blood thinners. Maybe their family members had a stroke, they have an
Yeah.
irregular heartbeat, they're on a medication called warfarin. This is genuinely like your older population.
Yeah.
What goes hand in hand with the older population? Memory. So ginkgo is something that everybody wants to take, to help their memory. But ginkgo has been shown to increase the effects of blood thinners. And those patients
Wow.
are brushing their teeth and starting to see bleeding gums or blood in their stool or their urine. And thinking that it's medication based or something's wrong, not knowing that it's a potential interaction with the vitamin or supplement that they recently started. So those are just two different age groups, different
Yeah.
examples of how, vitamins and supplements can interact.
Absolutely. And I didn't include this as a question, but whenever you go to the pharmacy and pick up a prescription, they always say, "Do you have any questions for the pharmacist?"
Yeah.
That's your opportunity to say,
Yes.
"Hey, I have this new medication." If you missed the opportunity to ask the prescribing provider, whether it was your
Yeah.
nurse practitioner, PA, physician's assistant, or your MD,
Mhm.
medical doctor, or DO, doctor of osteopath, if you miss the opportunity to ask them and they say, "Do you have questions for the pharmacist?" That's a free consultation. The
Yeah.
pharmacist is not going to say, "I'm not answering your question until you hand me your insurance card." And I
Yeah.
think that's a huge miss for society. We're in a rush, we're running errands, we're
Yeah.
picking up our prescriptions. But when they say that, "Do you have questions for the pharmacist?" Actually, yeah, I'm thinking about taking vitamin E. Is it cool if I do that with this?
Yeah.
Like real
Exactly.
quick to save your life. It really could.
Quick questions, and it always happens at the quick questions, at the counter, you see patients looking at, getting a certain amount of medications. You're like, wow, you're getting every day you're here, you're getting an exorbitant amount of ibuprofen, and I can't get rid of that headache, not knowing that it's probably their blood pressure, right? And they're not
Yep.
following up, they need to follow up with their doctor. So you're right, at that counter, at that brief interaction, there's so many things that are traditionally caught and unfortunately missed.
Yep. Absolutely. And it's free to talk to your pharmacist when you pick
It
up.
was
I want
use
to
their
emphasize that because huge miss.
yep, use
Huge
that
miss for us.
consultation window. That consultation window is
Yes.
life-saving.
It really, really is. So speaking of side effects with medications and or vitamins, how can somebody keep track of the side effects that they're having? So for the people, for example, you mentioned with the stool or
Yeah.
bleeding gums, like once someone notices a symptom in themselves, how can they start to track it so they can report that back to their pharmacist or their doctor?
So one of the first things that I definitely recommend to all patients is within the first 6 weeks of starting a medication, journal and write down how you feel. Let's say you start a blood pressure medication. You should have daily recordings of your blood pressure to understand what's happening that day. right? Same thing with blood sugar. You have that monitoring. So monitoring how you're feeling for those first 6 weeks as your body gets used to a medication. Because again, it takes time for that drug to build a concentration in your system,
Right.
right? And with that, remembering every additional supplement or every additional medication that you're taking. So that is very difficult because sometimes you're going to go to the oncologist that is not in communication with your endocrinologist, right?
Yep.
So having that list of your medications that you're taking and writing them down. One of the things that is very difficult is with patients when you're collecting a medication history and you're like, can you tell me the medications that you're taking? And they're like, I take, they can't remember the names. They're not able to remember they know why they're taking it, but they can't remember the names, the
Yeah.
dosages. So I always try to tell patients one of the best ways is to have a medication list, writing down the name of the drug, and what's it for?
Yeah.
What is this medication for your thyroid? Is this medication for your blood sugar? You don't have to say diabetes, just write blood sugar.
Yeah.
Keep it very layman's just so you know what you're taking that medication for.
Yeah.
Writing down how you feel on a regular basis. And when you write down how you feel, it is something that is so important because it rolls into adherence. And believe it or not, less than 50% of people take a medication as prescribed. They're started on a medication,
I believe it.
they went to the doctor, they got that prescription, and they're like, whoa, that made me feel funny. I'm just gonna stop.
Yeah.
What was funny? Is it a side effect? Was it an adverse effect? Was it a drug interaction?
Yeah.
So this is why I always describe for the first 6 weeks, really toning in and writing down how you feel today. Sad, happy, irritable.
Absolutely.
I used the bathroom a lot today. Those simple things because it can really help us hone in on if it's just a side effect that maybe we can give you metamucil to help bulk up your stools,
Right.
or unfortunately the patient just stops taking the medication altogether and then it just another cascade of
And
events.
that can have an adverse effect. If you just suddenly stop a medication without doctor's orders, it can actually do more harm sometimes than good when we do that.
Yeah. So that's why it's so important with side effects and just writing. And what I would tell people, even if I'm starting a new medication, just really writing down how I feel, just 2 words, 3 words, so that when I go back, I'm aware that, that this occurred with that. And we can hone in on it and say, continue to take it, stop taking it, or we'll change your medication. And we can do that, but we really need the participation of the patient.
Right, right. They definitely need to be engaged in their care. So, what are some ways that patients can advocate for themselves if they experience adverse side effects or interactions or feeling funny? What can they
Okay.
do? Should they call their doctor? What should they do?
So that's a great question. Yes, definitely booking an appointment with your doctor, speaking with your pharmacist. Again, sometimes we have multiple prescribers, multiple providers for our health. And one thing that I think is very helpful is getting your medications filled from one pharmacy. If
Yes.
you're able to, because that prescriber, that pharmacist is able to see and funnel all of the medications that you're getting from multiple prescribers and see where there's any risk of possible interaction,
Yeah.
right? As people of color, we know that there's a lot of intimidation when we go into doctors' offices. We're often not listened to, right? We're not listened
Yeah.
to when we're sitting in front of our doctors and our providers. As much as we'll go to the doctor and describe our symptoms, we're often brushed to the side, and that is something that is just so frustrating that we witness in our healthcare system. And so, what I would definitely tell a family member, myself, my mom, you, bring a buddy with you to the doctor's office. I know it's
Yeah.
private. I know that you don't want everybody knowing your business, but there's someone you're a friend or family member that can be there with you to, remember everything that was said. Maybe remember last week we went out to brunch and you described that you had a funny feeling in your stomach,
Yep. Yep.
so I strongly believe in bringing a buddy with you to the doctor's office. I strongly advocate for never forgetting to get a second opinion. Okay. Healthcare providers are not God. It's not
Nope.
don't be afraid to get a second opinion, and see what other alternatives you have for care. So like I said, definitely never being afraid to bring a buddy, getting a second opinion. When you call to speak to your doctor, letting the receptionist know what you want to talk about, right? Because I feel
Right.
something. I go to the doctor's office and I feel rushed. I said, I waited out here for 2.5 hours and you're in here for 20 minutes.
Listen,
You are
it's
supposed
that.
you're going to listen to me. And so, speaking with the receptionist when you make that appointment, letting them know what you want to talk about, bringing your little list, like what your concerns are, on your little notes, is something that can be beneficial to help you advocate for yourself. Because, racial disparities in healthcare is just as apparent as the justice system, school system. It is there. And we have to really be making it a conscious decision to know that we have to advocate for ourselves, because there are an abundance of studies that show us that even though we are going to the doctor, speaking with the healthcare provider, we're still getting subpar care. So it's really up to us really advocating for ourselves to ensure our quality of care.
I agree 100%. The next thing I wanted to talk with you about is you talked about already a little bit how sometimes people are not taking their medications like 50%. So even sometimes when people are taking their medications, they may not be taking them correctly. So,
Yeah.
for example, some medications will say, take this 2 times a day, right? Does that mean breakfast and lunch? Does
Yeah.
that mean after meals? Does
Yeah.
that mean 7 a.m., 7 p.m.? Does it, so it's so important that people ask questions. And I think that I'm pretty sure CVS has done an excellent job of putting icons on their bottles
Yes.
where they have the sun like rising, then they
Yep.
have a symbol for lunchtime, and then they have like the moon for evening, and
Yes.
like being really clear in their instructions on their medication. But wherever people get their prescriptions, or if that still is not clear enough,
Yeah.
I think that people should ask, okay, so what time? With
Time.
meals or without meals, not just twice a day, because then you may not be reaching the therapeutic level. You may be harming yourself. You may be not getting what you need from the medications. But
Absolutely.
other than like adverse health effects, are there any other ways that people are negatively impacted or the health system is impacted as a whole when people don't take their medications at all or incorrectly?
Yes, I think that one of the major things that we need to do as prescribers is simplifying a patient's medication regimen as much as possible,
Mhm.
right?
Yeah.
We already know that when a medication is prescribed 3 times a day, your patient's not going to take the medication, right? So you always want to make sure that you're trying to prescribe a medication that's either once a day or twice a day. That 3 times a day, 4 times a day, 5 times a day, you're definitely gonna have an adherence issue with your patient, right? So that's something that we're
Makes sense.
taught immediately. So you try to look for extended release products, things that slowly impact a patient like throughout the day, that they only have to take it once with breakfast, that they can associate it more like with a ritual, right? I brush my teeth, I take this medication. How to safely incorporate it into the patient's lifestyle. Like when I
Right.
wind down before I go to bed, this is a part of my ritual as I go to sleep, right? So as a prescriber and medicate, that's one thing that I always try to recommend to prescribers to help with patient adherence. Secondly is definitely cultural competency. Do you know the culture of your patient and
Right.
the stigmas that are associated? My family's from Grenada, and I always tease like with my aunts and uncles, they'll ask them about the milligram amount of a medication is so important to them. They feel that, oh, I'm only taking a 5 milligram tablet. Let that medication say 75 milligrams. They're just like, I'm gonna die. I'm so sick. Like, this, I swear.
That's funny.
They don't remember the name of the medication. They don't remember, but they just remember that it's it's a small dose. It's just a 5 milligram. It's just a 5 milligram. And I say, okay, there's nothing wrong if you have to take a 100 milligram medication. It's a different drug, and
Yeah.
it's just as potent. It just needs, but it matters. It matters, and it helps them feel empowered to take the medication. So understanding the culture, understanding the stigmas that people have to certain diseases, um, the incorporation of when you of mental health, like that,
Yes.
all of those things, like just understanding the stigma in the culture and how to communicate with it. Another thing that I really promote is support groups. I think that
Mhm.
every person that is a diabetic should be a member of the American Diabetes Association. Just getting some additional information, speaking to people that are living through the disease as well is just as effective, because a lot of times you're only able to speak to your doctor or get an appointment every 3 months, and a lot of
Yeah.
your concerns, you're going to go to Dr. Google, and Dr. Google might have you thinking that you need to get your leg amputated. So if you
Yep.
went to the American Heart Association, found a support group in your local community, that's a
Yeah.
great way to promote adherence and promote healthy medication therapy. Finding support groups is another avenue.
Yeah. I like that. I hadn't thought of that, but that makes a lot of sense. And making sure that it's aligned with an organization like American Diabetes Association or American Heart Association, so that there's at least some sort of oversight that the information is mostly accurate.
Yeah.
So before we wrap up, I have some rapid fire questions for
Yes.
you.
I'm
Are
ready.
you
I'm
ready
ready. I'm
for
ready.
them?
Yes.
I got three. The first one is, what does wellness mean to you?
Wow. That is a great question. I think that I try to understand wellness as a holistic experience, right? We always know that wellness is physical, right? We're going to look at our numbers, we're going to look at our diseases, we're going to make sure that that aspect of what we think is health is our wellness, right? I think that our social wellness is as important, which is why one
Yes.
of the things that I really focus on is social and community when we're living and living through a disease process.
Right.
Our spiritual wellness, that is something that we do know that meditation and making sure that we're in a positive state of mind when we're going through any type of challenge is probably one of the most important things. If the mind isn't there, the body is not going to follow,
Not
right?
at all.
Our spiritual wellness, our intellectual wellness, making sure that we're getting accurate information. The other and the scary thing about social media and the powerful thing about social
Ooh.
media is that you have access to so many people and so many funnels of information. I'm not sure if you saw that documentary, The Social Dilemma, and how
Yes.
social media like funnels what they believe you want to see.
It's
And
crazy.
that is so scary. And it was one of my inspiring avenues to really want to create Kiss Wellness and get into a platform, is that I realize that we are still, as Black women and as Black people, still always the highest statistic for certain things, right? And
Absolutely.
if we're out there and we're talking about it, we need to get on those platforms, your day off, get on those platforms and talk to our community and reaching out, because again, I see our patients in the emergency room, but by that time it's already an emergency, right? How do we
Yep.
communicate and reach out, so that just as we would communicate about music and fashion and hair care, our health and wellness should just be just a part of that basic conversation.
Agree.
um, financial wellness, that is another,
Ooh.
understanding that, like I said, the healthcare industry, health vitamins and supplements is a $1 billion industry, and understanding that you don't have to be a billionaire to have your wellness, right? And
Right.
speaking with healthcare providers, we can make sure that you are getting a therapy that is just as effective and that
Yeah.
you can afford, because
That's a
you
big piece.
prime example, I'm sure everyone is about this Ozempic, right? Ozempic,
Mhm.
taking Ozempic to lose weight. Ozempic costs $900 a month.
Woo!
$904 a month to
Wow.
maintain Ozempic therapy, right? Metformin is $11. We can get the same benefit, but we have to understand what we're able to afford,
Right.
right? And Ozempic, great, you see it on Oprah's doing it, but it's all a part of it's all a part of the marketing. And I love Oprah. I love you, Oprah. But just
I love Oprah too.
I love Oprah. But just again, she can afford $900 a month for a medication. My mom can't, right? So
Right.
this is something that we really want to talk about in like the health and wellness space of knowing those avenues for your pillars. So wellness is a holistic approach. It's not just one thing, and to really cater to that one person. Wellness is individual, but we need to know aspects of someone's life to really hone in to their individuality to promote their wellness. I guess what I'm trying to say.
Yes, that's
Yeah.
perfect. That is so perfect and such a comprehensive answer. My next rapid fire question for you: why is Black health literacy important?
Yeah. Oh, wow. Um, it wasn't until I started practicing in healthcare that I was really aware of the disparities, right?
Yeah.
When I was in school, you learn disease states, you learn drugs, you learn the whole science of it. And you're like, well, if you just do this and you just do that, it's gonna do this. Like, why are we not, why is that not happening for us?
Yeah.
And um, we think about the Harvard Global Health Institute, and I always bring this topic up about the Harvard Global Health Institute that actually showed that medical students believed that Black people had thicker skin than white people.
Yes.
They believed that we have less pain nerve endings at our skin, which is why we have a higher threshold for pain. This is not 1813. This is 2013 when they were able to bring out this study. And these were medical students,
Yeah.
okay, not a layman in the street. So when I think about overall, medical literacy is just unfortunately low in our society. But when you add on that layer of racial disparity and unconscious bias that is even coming from our providers, our
Right.
our literacy of our health is so important. I'll use myself for example. I had to have a procedure where I had to have my right fallopian tube removed.
Okay.
And I'm lying on the bed and my surgeon comes over to, just debrief with me, calm me down, just, hey, you're gonna go to surgery. Just FYI, healthcare professionals are the biggest babies when it comes to any type of medical procedure. And my surgeon said to me, oh, we're doing a bilateral tubal removal. And I was like, Doc, bilateral? No, we're doing right. It's lateral, the right lateral. And he said, oh my
Yeah.
God, yes, 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 yes. We're doing a right lateral, not a bilateral.
Oh my
Okay.
God.
Thank God I knew what the word bilateral meant.
Yeah.
How many people do not know what the word bilateral means? What if English was not my first language and I'm so scared and intimidated to even question my doctor,
Right.
because the surgeon is coming in their white coat and this is God in front of me that I wouldn't have even felt comfortable to correct, you
Right.
know so that is something when I speak about the importance of Black health literacy, just as being a patient, our community, it's very important for us to know what we're our care, following up, making sure that we're using all of our resources as much as possible to make sure that we're getting the best possible care, because one, medication errors occur, we know
Yes.
that happens. um, the unconscious bias when people of color are in front of you and is a major issue, and the fact that and the major fact that overall health literacy is just low in our country. It doesn't even matter if you're Black or white. They sometimes they automatically assume that the white patient is more intelligent. I
Yeah.
don't know why. But
Yeah.
so those are three factors, and being a patient myself, just the fear that I saw when I was
Right.
getting ready to have surgery. So
Yeah.
those are some reasons why Black health literacy is so important. We just can't always rely on our providers to make sure that they're optimizing the best care for us, because they do have their limitations as well.
Absolutely. And I appreciate you for sharing your personal testimony. There's power in testimony and power in personal experiences, so that everything is just not, oh, this is out of a textbook and this is a
Yeah.
theory. We're really out here living life. And like I shared mine at the beginning, I'm a public health professional, and sometimes healthcare professionals are patients, and then it's like, ooh wee, that literacy will save your life sometimes.
It will. It will.
It
Yeah.
really will. So you have been a phenomenal guest. I love everything
You.
that you have shared today, and your energy has been amazing, and I cannot wait for this episode to release. How can people connect with you, learn more about Kiss Wellness, Dr. Griffith, all of the work that you're doing to improve the world?
Wow, thank you, thank you. Please follow me at Kiss Wellness, KIHS. It's just keep it healthy and simple, right? The simpler we keep our healthcare and our healthcare knowledge, the better we're going to take better care of ourselves. So you can follow me at Kiss Wellness on Instagram and TikTok. You can also go to my website, which is www.kihskisswellness.com. Make an appointment, follow up, see what we're doing here in the community in Miami. We're all about community wellness, community health, and just making sure that literacy is out there with medication therapy management. It's important. We take medications and supplements every day, and it's just something that I think that it doesn't hurt to learn a little bit more about.
Absolutely. I will definitely put a link to your Instagram and website in the show description.
Yeah.
And I thank you so much for coming on today to share your expertise.
Thank you for having me. I love your platform. I just fell in love with you the minute I saw your platform on social media, and just grateful that I had the opportunity to connect. It's a great way to start 2024, and thank you so much for giving me the opportunity.
Yes. Yes. Second day of the year. You are so welcome.
Thank you. Thank you. Thank you.